Today we're going to be looking at claustrophobia and how we can improve our comfortability and just overall claustrophobic feeling as we're sleeping. Now, before we start this video, I just want you to know that you're not alone. Claustrophobia is a widespread issue amongst many people starting CPAP. It's almost weirder if you don't feel uncomfortable or don't feel a little claustrophobic when you first start CPAP. So if you're watching this video, you're not alone. A lot of people get through it. You know, claustrophobia is just the fear of confinement or confined spaces. When it comes to CPAP, it's a little bit different because you're not confined in a body, you're just more confined on your face. And there's a lot of things that are kind of both claustrophobic feelings, but also just things that are uncomfortable that kind of enhance those feelings as well. So I just want to talk about both. So the first thing we're talking about is going to be training your mind to be more comfortable with a CPAP. I recommend taking off the headgear and just learning to breathe and learning to be comfortable with the mask cushion itself. So to do that, we just break it apart. Because we took the headgear off, it's extremely easy just to pull it away as soon as we feel a little uncomfortable and put it back on once we feel comfortable. If you just try it with the headgear without the tube, try watching TV or something like that, and you all of a sudden get kind of a panic attack, kind of a claustrophobic feeling, it's kind of hard to take off the CPAP mask, and that kind of associates kind of a negative feeling that you're trapped, you're trying to do your clips for the first time, and it feels like you're trapped, right? We don't want to have those negative associations with your mask. So by starting with just the cushion like this, breathing easily like this, feel a little bit stressed out, take it off, super, super easy. Now, when you finally get comfortable with the cushion itself, say you can have it on for a few minutes at a time and you're taking it off just because it's more annoying than you are stressed out, and like you're controlling the reason why you're taking it off, then you can probably put the cushion onto your mask and wear the mask for the first time. So I'm gonna keep this mask disconnected from any tube or anything. I'm just gonna put it on. Now, to make things a little bit easier, you might wanna loosen the straps. So you just have it on your face, but you can still like breathe completely easily out through the bottom. So you have it on, you feel it around. Like in terms of my breath, I actually don't feel any impediment because I can breathe at the bottom. So this would be the first step. And then as you get comfortable with this, you can tighten the straps a little more. Okay. Now, when you get comfortable with the mask on your face, you can kind of increase the duration of time you're wearing it for. Some people say watch some TV, watch a movie. I think it's important to note not to try to watch like a whole movie with your CPAP mask. Some people feel that they have to get through a couple hours wearing it in the day first before they wear it at night, because at night they're going to be sleeping 8 hours. So how are they going to sleep 8 hours with it if they can't even get through like an hour or 2 hour movie? I would not do this because you're probably going to get just uncomfortable 25 minutes in, and you're gonna develop that negative association with the mask. You're gonna take it off, you're gonna finish your movie, and you'll be like, I can't even get through 20 minutes. Hello, darkness, my old friend. Without sleeping, just having it on your face, having it for more than 20, 30 minutes at a time can get pretty cumbersome. So I would just have it shorter. Watch the first 15 minutes of your movie with the mask and take it off when you're comfortable, not when you feel like you need to take it off. Another great way to get your mind off things is just to play a game, and then you can just wear it for the duration of the game. So if the game's a 5-minute little game, you can just put on the mask, wear it for 5 minutes, and take it off. You want to be in control of putting your mask on and taking it off, and never getting to that point where you feel so stressed out you have to yank it off. Okay, if you get your CPAP, you get it mailed to you, you get it at a CPAP clinic, you take it home, you don't have to use it that night. You can take it apart, put it on your nightstand, try wearing the mask for a movie, do something small during the day. You can do these little things, and then in a few days, once you're more comfortable wearing the headgear in general, it'll be a lot easier to fall asleep with the CPAP versus putting everything on day one, being stressed out. You don't even know if you're doing this right. It's uncomfortable. You just get stressed out, and then you hate CPAP going forward, okay? Take it in little increments. Okay, the next thing is the CPAP machine settings itself. So there's a couple of different settings that we can change on the CPAP machine here. So basically we can go into my options and change any settings there. So for example, with ramp time, you can change the amount it ramps up to your prescribed pressure. So if your pressure is a 10, it's gonna start at 4. And then if you click say 10 minutes, right, it's gonna take 10 minutes for it to go from a 4 to a 10. Okay, so you can change the ramp time. You can also make it automatic or off. And I would definitely recommend having a small ramp time so that your body just gets used to that lower pressure, and hopefully you feel pretty sleepy by the time it gets to your prescribed pressure. Now, to get into your clinical settings, we're just gonna take 2 fingers and double click on the purple and the blue buttons, and you're gonna see this white clinical home menu area. And then we're just gonna click settings here And we have set pressure, CPAP. You can change your CPAP mode to APAP, so automatic pressure, just continuous pressure, stuff like that. But what I want to show you here is our pressure relief settings. So our pressure relief settings, or our EPR, is just how the machine is going to fluctuate when you exhale. So if we turn on the EPR here and we have EPR type ramp only, we can have it full time as well. And then we can adjust the level, so 1, 2, 3. And having the change in the pressure it's giving you as you inhale and exhale is gonna make you feel a lot more comfortable with the CPAP. You're gonna find that when you first start using CPAP and you exhale, it might be kind of hard to blow against the pressure that it's blowing back at you. So having your EPR, your pressure relief settings on, is really important. So for example, we're just gonna click level 2, and therefore if you're at a pressure of 10, when you exhale, it's going to find out when you're gonna exhale. It's gonna kind of know when you're gonna exhale, and then it's gonna back off the pressure to an 8, so 2 levels below that, so that you're gonna feel the difference. So it feels like you're not pushing against so much air. Okay, now if you're at a pressure of 4, it's not gonna dip below. So it actually might be more comfortable if you step up to a 5 or 6 and you turn your EPR pressure on, so that there's just some variance between your inhales and your exhales. If you don't have that variance, it's gonna feel a lot more claustrophobic breathing with your CPAP for the first time. Now, when you're done with your pressure relief settings, you just exit the clinical menu, and then you're back to the home and you can start your CPAP therapy as per normal. Now, even though I showed you how to get to the clinical menu, make sure that you're talking to your doctor or sleep therapist before you make any changes on your machine. The last thing I want to talk about is masks. I recommend watching some of our mask videos, but just be aware that there are different types of masks. There are full face masks, there are nasal masks, there are pillow masks that look like this, okay, that just kind of go underneath your nose. And it's important to try out some different masks at a store or a sleep clinic before you make your decisions. Now, if you're buying purely online, watch a couple videos on different masks to see if they might give you that claustrophobic feeling. Obviously, the Vitera has kind of this bar up front, so that is gonna make you feel a little more claustrophobic than something as streamlined as a DreamStation mask, where your full face is kind of out and about. So do look at the different masks out there. A lot of times on CPAP websites, like kind of the banner, the headband, or CPAP posters will show you this mask, but a lot of CPAP masks now are super streamlined, super simple. So don't go buying this mask or a bigger mask thinking that you need to have that one and that the smaller ones are less effective. You simply just see the bigger looking masks on posters and stuff like that just because they're more visual and make sense for advertisement. But at the end of the day, the best CPAP mask is the one you're going to wear.